Hello. Okay, so I'm going to record the first adult health video. So this will consist of the clinical site profile and 3 to 5 goals that I have for the upcoming shifts. So I am at research on 3 North. That is the Med-Surg unit. There are the client population consists of mostly older adults being 40 and over. The unit staffing pattern is 9 RNs, 2 to 3 patient care techs, and the RN patient ratio is generally 1 to 4, 1 to 5. Number of beds is 53. The typical daily consensus is 45 to 50, so the floor is typically full, always. The top 5 health problems or medical diagnoses commonly encountered, including surgeries. This is going to be sepsis. It's going to be COPD. Alcohol and drug withdrawal. That's a big one. Psych evaluation, diabetic ulcers or wounds. And then generalized, I think there was some dementia up there. There's a little bit of everything. Med-Surg is a good sprinkle of everything, right? The most common nursing diagnoses: risk for infection, risk for impaired gas exchange because of the COPD, because of the respiratory issues that a lot of these individuals are having that have a lot to do with smoking or drug use or alcohol use. Risk for falls because they're older, because they have dementia, because they have ulcers, because they have spinal issues, everything under the sun. Excuse me. I'm sorry. Psychomotor skills frequently performed, always IVs. Wound vacs sometimes. That's not a big, huge thing, but sometimes. Chest tubes. I saw some ostomies. Things like that. Electronic pharmacology resources of the most common meds. So that's going to be piperacillin. I actually had a patient the other day who was on piperacillin and had to have it switched out. She was coming from a surgery for her uterus. Vancomycin, morphine. I helped push a couple morphine boluses the other day for pain, and metoprolol, losartan, things for high blood pressure is almost in everyone. So, 3 to 5 goals. One goal I always say as one of my first goals when I'm beginning a new clinical floor and unit is that I just want to get familiar with the floor, where all the Pyxis machines are, where the nursing stations are, where the supply rooms are, and what specific supplies are in the supply rooms. And one thing that's really interesting to me is that I didn't see anyone on the floor putting away their patients' eating trays, like their food trays. I've never seen that before. Usually their nurses take them to like the cart that has the area to put the trays in. They would just leave them outside of the room. I mean, that's crazy to me. I don't know, but I think I'm going to make an effort to start putting them away. If I come across them or if they're my own patient, maybe the nurse will be like, oh, maybe I should be doing that, Number 2, it's going to be how to deal with this. My husband just got home. So how to deal with these different patients. They're all coming from different areas. They all have different types of problems. And this is very different from my first Med-Surg unit because it was at Menorah. very different patients here, very different area, different health issues. Menorah had med-surg, but it was more tele patients. So I'm just gonna, I don't know, I'm just gonna watch and learn. Already different meds. I never saw anyone or pushed morphine when I was at Menorah. It's gonna be different. Number 3, I'm going to not be so afraid. I am not a scared person. I am not easily intimidated or offended, but I was a little, these patients are so different. I was a little intimidated and a little, I don't know, maybe it was because of the nurse. The nurse wasn't very confident in herself. So maybe I wasn't very confident, which is different for me, but whatever. Anyway, I'm very excited. Hi, I'm doing a video for school. And so I think it'll be good. I think it'll be a great experience because it is such a different and widely versed hospital and floor. So we will see what it brings. Thanks.